seeing the case study on HIV, that is human immunodeficiency virus. Our students of Allied Health Science from the Department of Physician Assistants have learned something on the HIV virus and they are very interesting in sharing their case study. They often visited during the hospital postings. So some of the case studies the students have may come across during their clinical postings. So we'll see as follows.
Hello everyone, I am Pravya in the Department of BSc Physician Assistant in SNSCAHS College of Allied Health Science. We have microbiology subject in this year and we have studied about HIV virus, HIV structure and enzyme step involving HIV replication and pathogenesis, opportunistic infection, lab diagnosis, treatment and prevention. Now my friends are here to share some case study and scenario about human immunodeficiency virus.
Hi all, we have actually seen a case about HIV from our previous clinical posting about a 32-year-old male who had a complaint of fatigue and night sweats for the past 3 months. He also had a report of history of unprotected sexual intercourse with multiple partners. Vivdashni, can you list the diagnosis test?
And yes, we shall take a test, Western blot test. This is the important test of diagnosis the HIV. The another one is polymerase chain reaction test. The another important HIV test is the CD4 count and the complete blood cell count.
Ready.
These are the tests needed to diagnose the HIV.
So yeah, students, by their case study, you would like to know what are the lab diagnoses. So as she said, the CD4 count is very important for diagnosing the HIV because HIV mainly affects the CD4 cells of our immune system. Okay, so the CD4, complete blood count, PCR and the Western blot assay is required for the diagnosis of HIV. Yeah, very good.
The next case is during our clinical posting, I also experienced the one case. The case about the 29-year-old woman test negative for HIV, but her partner has positive for HIV. What preventive measurement recommended?
Okay, in this case, the preventive measures recommended is pre-exposure prophylaxis, recommended daily oral pre-exposure prophylaxis with tenofovir, disproxil fumarate, then use condom to reduce risk of sexual transmitted infections and regular monitoring checkups. Yeah.
Coming with one partner positive and one partner is negative, we may go for the pre-exposure prophylaxis. So this woman has negative HIV. So in this case, pre-exposure prophylaxis is recommended for any of the antibiotic drugs or antiretroviral drugs may be given, and the use of preventive measures such as usage of condom during this sex also recommended by preventing in the HIV. Yes.
And the next case study we observed during our clinical posting, 30 years old pregnant woman at 12-week gestation was diagnosed with HIV during prenatal screening. Her CD4 cell count is 600 cell by mm².
Yes, we have in the microbiology subject in this year. We are learned to hear HIV in the last class.
What is the primary goal of HIV management?
The primary goal of HIV management is suppress the load of undetectable level of prevalent mother-to-child transmission like breastfeeding, pregnancy, etc.
Okay, what the therapy used in HIV?
Antiretroviral therapy is used in HIV. I am already seeing in the therapy in clinical posting. Intake in antiretroviral therapy immediately throughout the pregnancy, breastfeeding, and postpartum.
So in that case study, the HIV was infected the pregnant women. So in this case, childbirth and breastfeeding. So this could be avoided during the continuous intake of ART, which is antiretroviral therapy, by the pregnant mother to prevent that transmission to the child.
In the next case, we observed during our clinical posting a 26 years old female positive with in the next case, we observed in our clinical posting 26-year-old female present with HIV positive, and the symptoms include shortness of breath, fever and cough. The diagnosis by chest X-ray, it's resulting bilateral infiltrate and positive result to pneumocystosis.
Yes, there is a spread of opportunistic infection in HIV patient that was told by our ma'am.
And what are the diagnosis and how to treat it?
In pneumocystic pneumonia, the CD4 count cell is below 200 mmHg. It is treated with corticosteroids to reduce inflammation.
Yes. So other than HIV causing AIDS, that is acquired immunodeficiency syndrome, we have another chance of opportunistic infections like in the form of fungi or bacteria. So coming to the bacteria, we have the opportunistic infections of Mycobacterium tuberculosis, and coming to the fungi, we have candidiasis infection, which is caused by the candida fungus. So this pneumocystis is also a opportunistic infection in HIV, and this also can be prevented by some of the drugs. So overall case study was delivered by our student, was very interesting. So we will meet with the another infections case study. Thank you all.